Hi, Stacy. Thanks for having me on your podcast today. I'm honored. My name is Brenda
Welcome.
Cumming. I'm a registered nurse, and I've been a registered nurse for many decades, going on 40 years, and critical care, trauma, PACU, moved to Colorado in 1994 from Texas, and we moved up to the mountains. The pay was substantially less in Colorado for nurses than Texas. So there was an urgent care in this rural community that I live in, Evergreen, Colorado. And one day I was just looking at their little tiny newspaper. They were looking for an ER nurse to staff urgent cares. That was in 94. And I got the job and I did that for a while. So I didn't have to drive down the hill. And it was basically maverick medicine, big time. Still is a little bit. But the big hospital systems would buy these clinics. They would leave the clinics. These family practice guys would be stuck holding all this overhead. And finally, the last time that happened, they just said, I'm done. So I was looking through my Nursing Spectrum magazine in 2002, and there was an ad that said, learn how to do chemical peels, microdermabrasion, which got FDA approved like in the late 90s, spider vein therapy, and Botox. And I was like, who's going to get Botox? Closed the magazine, threw it on the bed. When that last clinic closed, I said, you know what? I might try this. In the meantime, I went back down to Denver, went to the hospitals, watched all these other girls did what I did, like the ICU and the PACU and ER. And I was like, I don't know if I want to go back to this. And the hours were bad. So I told the OR director at one of the hospitals, I'm going to give this aesthetic nursing a go. And it was brand new. And she goes, good luck with that. So I sent her Christmas cards for 4 years. Hey, I'm doing great. Okay. Remember back in 2002, there was no social media. There was nothing. I had to call the board of nursing and go, hey, I'm going to do Botox. And they're like, what? And I said, Botox. What do you mean? And I said, for wrinkles. Oh, is it in your scope of practice? Yeah. Okay. So I started, but sadly in my town up here, nobody would get Botox because we're very natural looking up here. Then it's changed a lot. So I went to Denver, I traveled. And then when I was taking that course in California, I learned about a skincare line that I'm not going to name, but I ended up being the rep for them for a long time. And I built like a $2 million territory here in Colorado. So I got to meet a lot of people and I still kept working on my business, my little med spa here and Evergreen. And I just kept building and building. And 25 years later, here I am still. I've mentored a lot of nurses coming up, helped for sure.
I think one of the biggest myths about the aesthetic industry is right now.
There's always been an undercurrent of, are you in your scope? Certain states allow non licensed people to do what I do. And all of us that go to nursing school or PA school or nurse practitioner school or go to medical school, we all learn what we're supposed to learn past the boards. Getting certified in aesthetic medicine or nursing is like a postgraduate class. We're all very familiar with anatomy and things like that. And then you focus down into more specific anatomy, like with Botox, injectables, body, whatever. So a lot of states allow unlicensed people. There was an account that I used to call on and publicly let the front desk inject Botox. So as long as you find a doctor who's okay with it and gets money for it. So do I think that we need to reel in this industry a little bit after 25 years that I've been in it? Yes. I think it gets a little haywire. And now there's rules coming out. We fought a rule here in Colorado where they were going to take away, they always want to take it away from the nurse, but the doctors will let unlicensed people do it. How's that fair? That's happening in Texas right now. They're trying to pass. And I don't think it will pass because that would be, you got to follow the money, number one. They'll say patient safety, but that's an oxymoron because if you're having unlicensed people do advanced procedures with filler, that doesn't make any sense. Like, where's the logic? Well, it's not even a myth. It's just sad because I've fought this. Like, certain groups of physicians don't think anybody but them should do it. And now is that patient safety or is that money?
Right.
But I'm blown away with all the advancements of aesthetic medicine and anti-aging and wellness. And most people who are like 40 and above want to look good for their state of age, or they don't want to look their state and they want to feel good as well. So if we're all still working, because I'm not planning on retiring anytime soon, I don't want to look my state of age. I don't feel my age. And which age group has the means and the wherewithal to do all this. 45 and up. Basically, I have patients that are 80 that I still do Botox on.
Hmm.
I don't do much, but it makes them feel good, makes them happy. And they're still
What it's
working.
all
Good for
about.
them. I might still be working when I'm 80. I don't know. Hope so. So I'm impressed with everything that comes out, but I think that we have to reel it in like exact science versus not exact science. So that's going to take some time before we say that's exact, like exosomes, which is a very hot topic right now. I'm not a fan of human growth exosomes in products. I'm just not. I like the plant. I like what you offer a lot. I like it for the anti-inflammatory benefits quite a bit. Anything that's going to calm down inflammation is a win.
Absolutely.
And just like your
Ab-
threads, I just had dinner with a colleague who's a plastic surgeon here in Denver, and he does a lot of threads. And we had a big talk about threads last night. And I told him I was doing a podcast with you, and he goes, he really likes. And I think if you know how to do them and know how to, how to place them, and they work. If you have patients who are absolutely against having a surgical procedure, having a facelift or whatever, then that's your next step.
Yep. Absolutely.
So we like the benefits.
Yeah. With all of the technologies coming out from skin boosters, biostimulators, different thread companies, how do you stay on top of all of the protocol and treatments? Like, how do you perfect your skill?
I think because I've been around for so long, I'm approached a lot. People come to me and tell me what's going on, or I'll read something and I'm interested. But when you say that word skin booster, I'm obsessed with skin boosters because I have patients who have been seeing me for 20 years and I can't really put any more filler in them. I can't, they get less Botox because it's been working for so long. And what we do here in my practice is we get the skin in shape. So when they come in and live at altitude, a lot of sun damage, but they come in and we have quite a few lasers, and my esthetician, my laser specialist, we get that skin ready, or we peel them or laser them. The skin is ready. And then what I do, threads, filler, Botox, that's like the frosting and the cherry on top. So she bakes the cake and then I sell it. Everybody's going to get a better result that way. Now you've come out with skin boosters, and I have patients who they love it. Like it fills in fine lines. I like it a lot for underneath here for texture, probably more than doing tear troughs with a filler because I have to do. I love your liquid under eyes. Love it.
It's amazing, isn't it? It's liquid gold. And
I love.
I know.
That's what we call it. I've got a couple of
Yes.
different cocktails that we make with it, and patients love it. They look airbrushed. It helps up here when you're starting to get some fat loss in your forehead after we hit a certain age. No amount of Botox is good to fix that crepiness. So taking liquid PROs or maybe a diluted Skin Vive and tapping it in with a device that has the gold needles in it. I'm not going to drop names. I've seen great results with that.
Excellent. Do you think, from your experience, is some of the biggest challenges that we are facing as an industry today?
I'm going to blame social media. Like I blame social media all the time. Like I've got patients coming in talking to me, and I know you've heard this, but I'm losing my mind. Beef towel of the skin. Just because somebody on TikTok said it doesn't mean it's true. And I've had to undo that, debunk that for the last month. Some of these influencers have no business making any kind of recommendations in our world. So definitely social media is a challenge.
Yep.
Just keeping up with the trends. And again, going back to, is there science behind this or are we excited about it? And there will be science behind it, right?
Yep.
Also, over injecting people, the patient dictate what they want versus what we're licensed and educated to do. I think some people struggle with that. And you've probably seen it.
Sure have.
Yeah.
What do you do differently in a patient consult to really try and help understand their aesthetic goals?
That's easy because if they come in and they're a new consult, and I learned this from a plastic surgeon a long time ago because I made the mistake. It was a rookie mistake. I bring them in my room, sit them on the bed, and say, "Why, hi, introduce yourself. What are you here to see me for today?" And they're like, "I want you to look at me and tell me what you would do." I've made that mistake once or twice, and I point out a brown spot, and it's game over. What brown spot? I never saw one. So I hand them the mirror. I said, "Let's start here, the top of your head, and work our way down. And we're going to come up with your complaints, your concerns, create a care plan, and start addressing them one by one up to where, we can do it medical aesthetic. Some patients need to be referred. If there's a ton of loose skin here that needs to be cut and pulled, then that's going to be their best correction. They may agree to that. They may not want to agree with it. So we just break it down. We take control. We make a care plan, and patients love that. Okay, they know I just come in and they do what they're doing. It's
Yep.
not hard. And if you don't address their concerns, no matter what, they're going to go somewhere else.
Yep. So other than the pointing out people's subtle flaws, what other lessons have you learned in your career that have been game changers?
Really like networking with peers a lot because we all can share ideas. I love the profession. I never thought that as a critical care nurse ever be sticking needles in somebody's face. I would have laughed and said, "You're crazy." And my mother is from Ireland, who talked me into being an RN because she's one. Now I feel like we just have to be on top of our legislation. We have to fight for our right to be able to do this. And then also make sure that we are addressing patient safety. I wish I would have had social media and peers that I could have called when I started. I was trained by Sasha Parker. I don't know if you know her, but she started the Aesthetic Skin Institute like in 2000. And she was probably the badass nurse I've ever met in my whole life. She fierce. She was cool. And she trained me. She changed my life. She totally set me on a career path. She was always available. The first time I had a patient, my very first Botox patient, I paid $374 for 100 units of Botox. It's double that now. And that's not a lot of money back then. And I had one patient in Allergan saying, "You have to use this bottle in 4 hours. They scare you." And I'm like, I forgot everything she taught me. It was a Saturday. I called her and she goes, "Hold the needle like a cigarette." And I was like, "Oh, thank you." And then I was fine, but I could always get a hold of her. I was an instructor for her for a long time, and she passed away a year ago, and it's absolutely devastating. She was a warrior. She went before Congress. She went, stood up against the dermatologist. She gets most of the credit for getting this industry, especially with nurses, going. Tons of respect for her. She had injectors training all over the United States, and I did that for her for a long time. Trained on Botox and filler. It's a little tough right now because I think the economy is slowed. So I'm glad that I've been in business for a long time and I'm glad I'm not brand new. I have given advice many times to nurses and physicians starting med spa, especially when I was training. And a lot of people probably call me because of how I came through this industry with nothing. I maxed out a credit card. But 25 years in, one advice I would tell anybody, a nurse or a doctor, is start small because there's
Mm.
so much competition now. So what are you going to do different, or who are you to make somebody come into your place of business? Don't go
Yep.
in big and buy 10 lasers and get caught up in all these lease payments and you don't have any patience, right? I didn't buy my first laser till I was in business for 5 years. I didn't
Wow.
have enough to justify. I live in a small community. I have one. That was the first machine I bought and I still use it.
Wow. That's a testament of time. With the uh, insurgent of med spas popping up in the marketplace and with the economy being slow, what do you do to set yourself apart?
We have a pretty active social media page. We try to do no downtime specials, and that is the biggest trend. And it has been a trend for a long time. And I've been saying it for 10 years. Social downtime. What is your patient's definition of social downtime? A bruise is social downtime for some patients. Being red. Nobody wants to walk around with their face falling off anymore. They want to see the results, get results quickly with a very little downtime. And that's where I like those Wikipedia threads. They're gorgeous.
I'll tell you what. Yeah, I this would probably get cut, which doesn't
I
matter
just
either way.
did
But
my face 2 days ago, so I could.
did you really?
Yeah.
Oh, that's why you're glowing. Yeah, I had my eyes. I got a blepharoplasty on the upper lids a week and a half ago, and I went for my 1 week follow up with the plastic surgeon, and he said, "Stacy, what did you do?" He said, "I have been a plastic surgeon for 40 years. I have never once had a patient come into my office with the lack of bruising that you have and the lack of redness. What did you do?" And I was like, it was Tendu. And I'm not suggesting that people do that, but topically, I just put it on over my little eyelids where it was the incision point, and then
It's amazing.
underneath.
We just did a CO2
Amazing.
laser yesterday on a patient and put the Tendu on her. And her before and after pictures are really impressive.
Yeah.
She doesn't want
And
Botox, she doesn't want fillers, she's a Colorado girl, pretty glycated, pretty photo damaged, and I can already see the difference
that's
taking the right.
incredible. And what is a nice angle with the Tendu, it's all natural. It's got
I
2
know.
ingredients. It's all natural, and it's gonna give you a very natural, healthy glow. Where do you see yourself or where do you see the industry 5 years from now?
Oh, I don't think it's gonna go away. None of us
Mm,
wanna get older, even though it's a little tight right now, people still want their Botox, they might give up some other things, or we might get creative and do our with PDO or attend to some kind of a treatment. We keep them going for a couple of months, but it's not going to go away. I think there's going to be different procedures. I think a lot of surgeons, plastic surgeons, are going to awake anesthesia. They're doing. I don't know how you had your eyes done, but
I was
two
awake.
two guys of mine, friends of mine, don't do general anesthesia. You're asleep, but you're sedated on like Thinergan and Halcyon, and then you wake up. You have less recovery time. You have less downtime. You can probably less bruising, less. That is gonna get to be a bigger trend, I think.
Interesting. I actually agree with you.
And still
Fascinating.
body because you can get your face looking one way, but all this is still going on. And people, they work out hard and they eat healthy. The GLPs and TLPs have really changed the industry, the weight loss medicine. And that is the new narrative in healthcare, like fighting diabetes, taking down prediabetes, and taking down heart disease. But if you lose weight too fast, you're going to have rapid weight loss and sarcopenia, saggy skin, and now people are like, "I don't like these, and I don't like these," and I've played a little bit with your PDO here, but I haven't tried
Mhm.
the 10-2 there yet. So,
Interesting. Yeah.
yeah, I probably do more Botox in necks now than I do in the face, because all my patients that have been seeing me consistently for a long time are not moving. Like, I
Mhm.
rarely get Botox anymore. I think I need it, and I'll go to my girls, and like, "Get out of here. We don't overtreat in my practice ever." We just don't, because that's our billboard. We want people to look good. But neck is still aging, and so doing those platysmal lines, doing along here helps a lot. So that's different.
Yeah, that is
When I've had
different.
patients that are seeing me for 20 something years, and if you gotta find another place to make them look good.
Yep, absolutely. What motivates your team right now?
I think they're proud of their work. Everybody's highly skilled in here. It's a happy place. Everybody's healthy. We all come from hospitals. People wanna come in. We're nice. We have a good reputation. We've been around for a while. We make everybody feel special. It starts with the experience when you walk in to when you check out. Remember, it is a small town. It's not as small as it used to be. I don't know if you live in a small town, so you might understand that, but it's the experience. Not being rushed. We're not one of those clinics that just turns and burns people out. We give them time. Because I want them to look good, not just Botox, but get that skin in shape. And then putting them on a professional skincare line because that's 80% of their success. It's an 80-20 rule. I do 20%, you do 80.
Mhm. I like that. Like that a lot. I generally like to ask everybody this question. If you were sitting next to an industry expert right now, would you ask them?
I don't know. A lot of people ask me. Probably the question that you asked me, even though I already answered it, is where do you see this trend going? I think it's more anti-aging. I see people morphing into these wellness clinics where they're doing like PRP in the joints. And now we're doing a lot of B12s and vitamin Ds and glutathione, and NAD is huge right now. And just this overall wellness. So not just looking good and the no downtime surgery. I think that's a huge trend that we're going to be seeing. And then dealing with the body and skin laxity after being on a weight loss program.
Yeah.
You know,
Hmm.
people want to be healthier, which they should be. We're not a healthy
Yeah.
nation. We need to be.
We definitely need to
I'm a
be.
dual citizen. I see everybody in Europe walks and they might smoke and walk, but they're thin.
Yeah, it's true. It's
Yeah.
very true. And I would imagine you being out in Colorado, you've got a lot of very fit people. But man, you leave that
Used to.
environment. Oh, really?
I'm from Texas, so I always thought we were really healthy down there. Every time I go home, I'm like, oh, yeah, we are definitely seeing some obesity here in Colorado, but like we normally would. If you're living at 1,000 feet like I do, you're working hard.
Yes.
Everybody moves here to have a fit lifestyle. That's the other
Yeah.
challenge is how do you balance people's outdoor activities and then wanting correction. Like I had this conversation with a guy friend of mine last night. He loves the sun. And I said, "You're killing me because you come in, you like the work I'm doing. And then I see you outside with that hat on."
To wrap this up for the sake of time, we touched on this in the very beginning, but are there 2 or 3 points of advice you would offer a new injector out there?
Start slow,
Mhm.
learn like three things really well. So be good at three things. I asked this plastic surgeon I spoke to last time, like, what are because he does all body stuff, he does everything. And I said, what are the three things that you really like? And he said, blepharoplasties, lower neck, and mommy makeovers. And I said, good, because I'm a huge referral source. So I need to know my guys what they're good at, and
Mm.
I'll refer. But he has three things. He could probably do 10 things. I could do 10 things. My favorite is Botox filler threads.
Excellent. And where can people find you and learn more about you out there?
On my Instagram, it's Medical Aesthetics LLC. It's Evergreen,
Okay.
Colorado, and that's my website as well.
Wonderful.
And
Thanks for your time today.
thanks. It was very fun. Thanks for inviting me. Congratulations on your success with all this.
Thank you. It's as a business owner, it is not easy and it never ends.